How to prepare for MCPS or FCPS obs and gynae. As MCPS requires 2 years of postgraduate training and FCPS needs 4 years of PG training, but techniques for exam are almost same. And remember that your preparation starts with start of training. Many PG students think that while during training they are just supposed to do the duties and follow the rosters, and they do not open their books very regularly or with a proper plan. But actually this is the best time to start your studies and decide about the books there and then. For example, as you have a lot of time to study for 2 to 4 years, so you prefer to go for the basic books with good knowledge and good like insight. For example, high risk pregnancy for obs and UHERTS and SHAWs for gynae, they are the best books. And many students use evidence based books as well. Whatever book you will like, do it regularly with a proper plan and discuss it with your study partner. And in this way you will make many basic concepts and you will be able to finish the basic books many times during your training. And at the end of first year you must like select your topic for research, discuss it with your supervisor and send your synopsis for approval. And similarly your dissertation should be done before the start of fourth year, so that in fourth year you shouldn't run after these type of tasks and you should only focus towards your studies and your exam along with your training, because at that time you will be senior in your ward and you will be senior PG and you will have a lot of responsibilities. So make this year for more studies and more clinical practice. And as during your training you will fill your logbook, you will like enter many procedures there. So try to attain the level of competency in each and every procedure there and then. If you will feel like there is some difficulty in any of the procedure, you are not good in any of the thing, then it is the time to discuss it with your supervisor and solve it there and then, and do not linger on with your problem. For example, many PGs are not very good in applying the surgical knots, so you have to correct your mistakes there and then. And during your training, as you are doing your theory preparation, you have to prepare your clinical exam side by side. And how you can do it? Actually you can attend any available course and get an insight that how to prepare for clinical exam, how to prepare for talks and long case and short cases. Once you will know it, then you try to practice it in your wards and in your OPDs. Whenever you are dealing with the patient or with your supervisor, try to do it in the same format as you will do it in exam. And there are many books for MCQs and EMQs practice. So before exam you can practice it with time management, and while you are inside the exam, try to solve all the questions which you know very well, or the questions with most difficulty in which you think that they may take time longer than the others. You just mark them. Once you will done most of the questions, you will come back to the difficult one, and then you can try them, so that your time management will not be disturbed and you will be able to handle almost all the questions. For clinical exam, practice with a study partner and attend at least 1 to 2 courses. This is very important part of the exam. Many students do not take it seriously, but if you have done it in a proper format during your PG trainingship and after your written paper, then you can do it very easily. It is basically very easy part of the exam. Just you have to remain focused and open and honest about your opinion, and dress properly with a proper dress code, be comfortable with your patient, and be comfortable with your examiner. Everything will be fine. So good luck for the exam.